Hi, I'm Will Hardeman, Hamilton Physician Group General Surgery. I was actually a missionary kid when I was a child. I lived in Bangkok, Thailand with my family for about 5 years and had a great experience there. You have a very well-rounded experience and exposure to things, outside of the United States. It made a big difference. Made a lot of trips to the hill tribes and other parts of the country there. Saw the poverty that existed there, the lack of health care that existed there, and really kind of spoke to me and of the need that existed, especially in third world countries and certain parts of the United States as well. After completing undergraduate education at Lipscomb University, took some time to do some research at Vanderbilt Medical Center. Worked in the anesthesiology department, doing clinical research there. And then spent about a year to year and a half actually working in the Children's Hospital there as a clinical coordinator, working with cystic fibrosis children. During the process of that, finished my master's of public health with a concentration in public health administration. After that, I further kind of was not completely satisfied with just pursuing research and more interested in the interactions that you have with patients, and decided to try to apply to medical school. Decided to go to PCOM, Georgia campus, Philadelphia College of Osteopathic Medicine, where I met my wife actually while we were doing orientation there, getting our badges. So completed 4 years of medical school training there, and then fortunately was able to match with my wife into residency. She did family medicine and I did general surgery, and been married about 8 years now and have 2 kids. Always busy in my house. During my 3rd year of medical school, my wife and we were selected to come to kind of this part of the state, and I actually was assigned to work with Dr. Rodriguez during my 3rd year. He showed me, just pretty much kind of showed me the ropes of what surgery would be like, and I quickly developed a passion for it. Spent a lot of additional time outside of the rotation, really pursuing it, and by the end of my 3rd and 4th year, I quickly realized, this is probably the only thing in medicine that I would be really happy doing. But he really turned my passions towards surgery during that time I spent with him here. I'm excited to get back south. I'm a big Georgia Bulldog fan. It's a good time to be a Georgia Bulldog. After living in different parts of the country here, the culture is definitely us. The Southern culture is where we want our kids to grow and become good Southern gentlemen. It has become more apparent over time that general surgery stands kind of unique among the other specialties, and that you're able to still practice medicine and make those changes for patients from a clinical standpoint, but you also are able to do a surgical operation and give patients somewhat of an immediate relief to a problem that ails them. Being able to go and be presented with a problem, whatever it is, and being able to take that patient to the operating room, immediately remove that from their life, and seeing how much, a fuller, happier life that they live after that is very satisfying for me.